Pakistan, The Future of Immunizations by Cinnamon Moffett. The endemic. The measles endemic in Pakistan is at critical. In 2013, 306 children died from measles. Compare that to 60 in 2012. Not only is measles a concern, but also polio and some other preventable diseases. Immunizations. So 1 in every 11 child in Pakistan dies before the age of 5. A third of those deaths could have been prevented through proper vaccines. Diseases such as diphtheria, pertussis, tetanus, polio, measles, and hepatitis B are all currently have preventable vaccines. In Pakistan, the common term for their main vaccine is called the pentavalent, which is similar to our MMR vaccine in the United States, the measles, mumps, and rubella. Free. It is free. $0, 0 rupees. There is little or no cost. Little for those in higher brackets, but no cost for all Pakistani children through the expanded program of immunizations, which was launched in 1978. So the question really is, why are they not getting their immunizations if they are completely free? So there's 3 categories here: education, women's rights, and geography, and we're going to talk about those here in the next couple slides. Education and women's rights. So we know that through reading Malala and our case studies and so forth that women do not usually progress beyond primary level of schooling, and that has been linked to children not being vaccinated. The thing is if you don't understand vaccines, then you're not gonna know any better. So not only being educated through schooling, but also the media helps promote parents to vaccine. There is a lot of promoting vaccines in Pakistan for people to get their children vaccinated. However, if you are unable to read and you're illiterate, that's not much help. And so when we talk about women and their education, we also talk about women's rights. And women need to be educated, but they also need to be able to make informed decisions in their families. They need to work alongside their spouse to make decisions for their children together. They need to have a voice. Every woman deserves a voice, no matter where you're at. The geography. So geography is a main concern regarding the delivery of vaccines in rural areas. Many who administer the vaccines have no vehicles or gas to drive to the more remote locations, so they just don't. There's also a safety issue there too, and there are some areas that are not as safe as others. They fear for their lives. The Sindh province has been one of the most affected areas due to poor nutrition, which leads more susceptibly to these diseases. These are the areas that need that health coverage area the most, but unfortunately it's taken measles and polio to get the attention of the masses. It's taken death of their children for them to start paying attention. So with them paying attention now, they've come up with a 4-year plan to eradicate the childhood diseases. So they started with polio, and they've worked into the others as well, especially with measles outbreak. I'm going to hit the side note first. So, like I said before, the media coverage has been pretty high in these areas. However, and with that being said, is that there's been a lot of funding that goes towards the campaign of vaccinating children. Unfortunately, it is going towards the campaigning and not the actual vaccinating. So there's a need to be some priorities that need to be switched around, and that's what they've done here. It's a 4-year plan to more effectively cover the range of vaccines provided for the children in Pakistan. So it includes prioritizing joint work plans, monitoring EPI vaccinations, increased human resource management, increasing funding, improvements in delivery, communication and advocacy planning for families, and regional variations. Now, this covers all the things that we discussed about earlier, is education for women through the communication advocacy planning, being able to travel and take these to rural areas and prioritizing where that money is spent versus just on campaigning. Hope moving forward. Every child, regardless of geography, education, or background, deserves a chance to live, Pakistan is taking a stand for its children and trying to eradicate childhood preventable diseases through a more resourceful and effective plan. I hope that you have enjoyed this case study, and with it there's more information in these areas in the citations below if you would like to continue the research in this area. Thank you.